The French Health Minister says France is ready to test massively once the lockdown begins on Monday. The country will be able to carry out 700,000 tests a week. Earlier, I spoke to Catherine Hill, an epidemiologist here in France, and asked her if only testing people with symptoms of COVID-19 is enough. Take a listen.
The main problem is that half of the contamination occur from a person who has no symptoms, either because they have not yet symptoms or because they will never have symptoms. So identifying patients with symptoms, testing them and finding them their contacts is just, I think, not enough. And also, I'm afraid this is going to take too much time. By the time the person with symptoms shows up and is tested, 1 or 2 days have already passed. And since the contamination is 5 days before symptoms and 5 days after symptoms, if it's symptoms plus 2, then you've missed most of the contaminating time. And then if you start looking for the contacts and they have been contaminated, again, if you take 2 or 3 days to find the contacts, then you have missed a lot of contaminating time. So I think the epidemic is going to start again, unfortunately. The solution here would be to test much more widely, but it's not the plan, and I'm afraid we don't have enough tests.
I just want to pick up on one point you just mentioned there. You said the epidemic is going to start again. Are you talking about that second wave of cases which we are going to get at one point?
Yeah, probably. Yes.
But the lockdown is easing on Monday, but we still have very strict measures in place. Here in the capital, Paris, parks are not open, restaurants are not open, bars will not be open, public transport will be still restricted. If you travel during rush hour, you will need to have a letter from your employer. So technically, there is technically a lockdown still in effect.
Well, that's not quite true. I mean, I look through my windows and I see a lot of people wandering around, much more than a week ago or 2 weeks ago. They're wearing no masks, and they're crossing each other. And now they're going to go in public transportation. They're going to go to work. They're going to meet other people. The virus is just the number of people you meet, you get close to. That's the risk. And if you increase that, you increase the risk. It's as stupid as that. And the situation in Paris area is sort of tricky also because in Monday, by May 11, there would still be something like 5,500 people in intensive care units, which is more than the usual capacity. 5,500 in the whole of France, but a lot of them in the Paris area. So the system is very stretched.
I want to talk about testing because in the United States, we have more and more people who are doing antibody tests. Why do you think France is not pushing that further? If I understand that the French President Emmanuel Macron said it doesn't make sense testing the whole population. Granted, but maybe testing one person per household in red zones like Paris.
You're talking about PCR tests or you're talking about antibody tests? No, antibody tests will find who has been infected. The problem is to find who is infected and who is infectious. This is the crux, the heart of the epidemic. Who is infecting other people? Finding people who have been infected in the past and are cured. It's interesting, but it's not the key to the thing. The problem is to find who is infectious, and that's PCR, and we need more PCR. And there are other ways you can test several people in one test, pooling the samples. You can also look for the virus in the sewage water and see if there is someone infected in that particular village or that particular small town. And if yes, you can start testing around. We have to find the people who are infectious and do not know that they are infectious, because they are infecting others.
I want to ask you a question about how the coronavirus, our ability to contract COVID-19, because I've heard of instances of people who have been in contact with somebody who's tested positive. This person has been sick, really coughed in their face. The person went back to London from New York, was hospitalized for COVID-19. They did the antibody test in New York and came back negative. So is it possible that some people just do not get it, no matter how close in proximity they are with somebody who is positive?
Oh yes, of course, of course. I mean, it's like a gamble. Not everybody in contact with somebody positive becomes positive, but it's just taking chances.
It was Catherine Hale speaking to me there earlier. Now, the US President Donald Trump has laid a